All right. Okay. Thank you all for coming and attending this. The purpose of this info session is really to kind of like give you an overview of what information we have as of now based on reliable sources with regards to the COVID-19 vaccine, and hopefully give you that informed decision making, share that with your staff, and also if you have any other questions, we would definitely have a question and answer portion at the end for you guys. So with that, let me share my screen. All right. So I wanted to clarify, some people are getting confused. SARS-CoV-2 is the virus that is causing this infection, this disease, this sickness. That is what you call SARS-CoV-2. It's from the family of coronaviruses. There's a lot of different other strains of coronavirus, like the common cold is a coronavirus. It's from the coronavirus family. And then the disease that SARS-CoV-2 causes, that is the one that we call COVID-19. So I just wanted to clarify that. This is just a brief, very, very brief overview. We all know COVID-19 goes through those droplets that goes into the air when you cough, when you talk or speak or sing, for that matter. It goes in the air. There are tiny particles that goes as far as 6 feet. There are tiny particles that goes way more than that, especially if you're coughing. And that's why wearing mask is really a very, very good protection for all of us. I'm not going to play this video, but because we're going to be posting this PowerPoint as well in our website, I wanted to put this in here because it's a very good illustration. It has visuals on how the virus spreads in the body and how does it wreak havoc in our immune system. So that's why I wanted that in here. And then this one, another overview of, and the link is here below, of what is the vulnerable conditions. These are the conditions that CDC have identified as high risk for severe COVID-19. And as we know, severe COVID-19 results to death. I highlighted Down syndrome here because that is one of the recent updates that CDC has made. Before, they didn't have Down syndrome there, but now they added that. This list is those that CDC has considered might be at risk for severe COVID-19. So I added all that in here as well. A lot of the time, people doesn't know. I'm going to go back here. Smoking is something that a lot of people doesn't know is included in that high risk, as well as obesity. This is one of the studies that is why we emphasize our community is at high risk for COVID-19, because this study has shown that people with developmental, let me use this here, people with developmental disorders here are 3.06 times at risk for dying of COVID-19. And then this one, people with intellectual disabilities or related conditions are 2.75 at risk for dying of COVID-19. And so you average that, is about 3 times the risk. And then this is one of the study that kind of like helped influence, I guess, I'm going to be assuming that it helped influence CDC in adding Down syndrome as to the high risk, because this study has shown that Down syndrome, they are 10 times at risk of dying from COVID-19 and 4 times at risk of getting hospitalized due to COVID-19 related illnesses, and that is after adjusting any heart disease, lung disease that they have. So we all know now that COVID-19 vaccine has been approved. So what do we do next? Part of that is why we're doing this info session. We want to give you all these good information, reliable information. December 10th was when Pfizer and BioNTech vaccine was approved by the FDA. December 17th, Moderna was approved. Right now, majority of us are in the phase 1A vaccine distribution, which is healthcare workers and long-term facility workers and residents. This, I haven't updated this, when Dr. Fauci said most likely summer and fall, the general population will get the vaccine. His recent interview was saying that most likely mid-fall, the vaccine distribution all over the country has been slower than anticipated. So what do I do next? You definitely want to decide if you want the vaccine or not. And that would, reading or listening to information will help you decide if you wanted that or not. And definitely get that from reliable sources, because there's a lot of misleading, false information that are out there. If the information is from CDC, from the Community Vaccine Advisory Committee of California, from FDA, those are definitely reliable information. Make sure you discuss it with your primary care provider. A lot of people have other underlying medical conditions, they have fears, so discussing these with your primary care provider would definitely help. Walgreens and CVS has a pharmacy partnership program with the federal and state government, and that is helping with the vaccine distribution as of now. Eventually, they will be offering it to all, but as of now, they're helping focus on that first phases of vaccine distribution. So we want to know, is it safe for me? That is the first question, right? Based on the emergency use authorization that the FDA has given, the vaccines are relatively safe for most people. For Pfizer, it is approved for 16 years and older. It has been tested on individuals with obesity, diabetes, lung disease. It has not been tested on children, so under 16 years, they haven't tested that. It has not been tested on pregnant individuals. If there are people who want to get pregnant or are pregnant, they should discuss this with their obstetricians. What's the side effect when you get the vaccine? Usually mild fever, muscle ache, fatigue, injection site reactions such as pain, swelling, redness. There is a warning by CDC, and they have updated their warning with regards to severe allergic reaction, and I will show you that later. I wanted to show you this document that you can download in this website. It's a 6-page document. It's a question and answer type portion, so it's easier to understand. What this is it tells you everything you need to know about this one, specifically for the Pfizer vaccine. One of the things in the CDC's advice is you want to make sure that you don't have any allergies to the ingredients of the vaccine. So here it enumerates all the ingredients of the vaccine. So you can look at that and see if you have any allergies to those ingredients. If you have any allergies to that, they do have a warning on that. With regards to the Moderna vaccine, it has been approved for 18 years and older. It was tested on individuals with lung disease, heart disease, obesity, liver problems, and HIV infection. It has not been tested on children, and it has not been tested on pregnant individuals, similar to the Pfizer vaccine. Side effects are pretty much similar: fever, chills, tiredness, fatigue, headache, injection site reaction, that pain, swelling, or redness, and the same warning with regards to the severe allergic reaction. And also, similar to Pfizer, Moderna also has a fact sheet for recipients of the Moderna vaccine. And in here also, they list the ingredients that the Moderna vaccine has. So it's in here. So you want to check that if you have any allergy to any of the vaccine ingredient. This is the allergy warning that I was telling you about. The green one here is telling you that if you have any immunocompromised condition, you're pregnant, you're lactating, the recommendation of CDC is you discuss it with your provider. They will definitely tell you one of these additional information is that to know for those for these individuals to know that these vaccines has not been tested on these individuals. And especially with those with immunocompromised conditions, they are not sure how much immunity your body will muster up when you get vaccinated. And they also recommend a 15-minute observation period. For those with history of allergy with any type of food, pets, insect venom, latex, they are recommending observation as well on this one. Another precaution is for those who have moderate to severe acute illness. They could either do the risk assessment with their primary care provider. They could decide to defer it at a later time, or they could decide to take it and have that 15-minute observation. This red one, the contraindication, I will show you an updated one because this allergies, this is the old one. The next one is the updated version. This one, these allergies. So if you have any allergy to any of the component, if you've had severe allergic reaction after a previous dose of the COVID vaccine or any of its components, if you had allergic reaction to any previous dose, including allergy to polyethylene glycol or immediate allergic reaction to polysorbate, you should not get the vaccine, and you should have consultation with an allergist immunologist. So one of the usual questions is, how long will this vaccine protect me? As of now, we don't know really how long the vaccine will protect an individual. We do know that the vaccines does provide a longer and stronger protection than someone who is going to get sick of the virus and then create their own immunity. Those that have been infected with COVID-19 and have been COVID positive, one of the CDC recommendation is that they could defer up to 90 days before they get the vaccine. Definitely you can discuss it with your primary care providers. I've heard of a primary care provider who has advised their patient to get it, even if they've had it and they are still within that 90-day period. So I want to emphasize this, that the vaccine could provide you longer and stronger protection. So that's why even if you've had COVID-19 before, it is still recommended that you get the vaccine. Having had COVID-19 is not a contraindication to getting the vaccine. The first dose of the vaccine will give you 50% protection. The second dose will give you up to 95% protection. Pfizer says that they give 95% protection, and Moderna says they give 94.1% protection. So that's why I wrote here up to 95%. When you get vaccinated, it takes about 1 to 2 weeks after your second dose before you are fully protected. That's why if you're going to count it from your first dose, it's probably going to be about up to 6 weeks before you could be fully protected from COVID-19. So does this mean I still need to wear a mask? That's another question. Definitely, yes, definitely you still need to wear a mask, because it has not been studied if the vaccine can prevent the transmission of the virus or spread of the virus. You could be vaccinated and still have an asymptomatic COVID-19 infection, meaning you have the virus, you're carrying it, you're spreading it to other people, but you don't have any symptoms. You're not sick of it. So that's why we still need to practice all the safety precautions, wearing masks, physical distancing, washing our hands, avoiding crowds after getting vaccinated. When you get vaccinated, this is a good website, the VSafe website that you can register. Other areas, like I got my vaccine today, they gave me a flyer with this that has a QR code. I scanned the QR code and it's easy to register your name. And then in the afternoon, I got a text message from VSafe telling me that it's my first health check-in. And so I clicked the link and it asked me a few questions. I answered it in maybe about less than a minute, maybe 30 seconds or so. And it's quick. This is a good way of basically gathering data. The data that you put here directly goes to CDC as part of their data gathering as to how safe the vaccine is for the general population. Those that are providers of vaccine, the ones that are giving vaccine, when there's any adverse reaction or adverse event, they are required to submit a report to VAERS, VAERS, Vaccine Adverse Event Reporting System. And so this is the link to that. So what has VMRC done with regards to vaccination? So about 2 weeks or so prior to Christmas, I've contacted each county, the 5 counties, sent them letters. It's really more for the long-term care facilities because they're part of that 1A long-term care facilities residents and staff. So at that time, I've received various responses. The interesting part here is each county, and not just in our catchment area, even in different counties, because when I talk with the other clinical directors, each county kind of like has a different process and interpretation of how they're distributing the vaccines. So for Amador County, we've given them the names of the care home providers. And then eventually a few weeks after, they needed the names of VMRC staff that lives in Amador, so that was given to them. They directly contacted the care homes and scheduled them for vaccination, as well as a couple of our staff that resides there. For Calaveras County, they referred us to the Pharmacy Partnership Program with CVS and Walgreens. Follow-up communication with them hasn't had any reply so far. For San Joaquin County, we did send them the names of the care home providers as well. And then last Friday, they gave us a message that VMRC staff can register. So there are VMRC staff that were able to get vaccinated on Friday. And today, you have probably seen that urgent message that came out from Tony with regards to care home providers, family caregivers, and SLS IHSS providers. For Stanislaus County, they have a different process as well. We've also sent them the names of the care homes and their contact information. And then for VMRC staff, they actually added as part of the Phase 1A Tier 2 vaccine distribution, though they are considered as one of those community health workers. And then they are aware, I told them that our comprehensive programs and ABA programs does go to the homes as well to provide services. So that's why they included comp programs and ABA as well. Their process is in such a way that they have an Excel spreadsheet. Those that want to get the vaccine would have to fill that out, give that information, and then I give that to them. They enter it into their database, and then they notify me when those programs can come. So today we have a few comp programs aside from our VMRC staff that were included in that. And then I was told that there was, I will check my email later, there's a few ABA, a handful of ABA programs that were submitted to them that those people can come tomorrow, actually. They don't need to bring a work ID. What they need to bring is a valid ID that has their name and their date of birth, because they're going to be verifying that in their database. For Tuolumne County, so same thing, we sent them the names and contact information of care homes and SLS. And I was told as of last week, they vaccinated about 20 providers and they're contacting them directly for scheduling. Other efforts are the ARCA clinical directors. We're meeting constantly. We have another meeting on Wednesday with regards to the consent, those that are going to be going through the CVS Walgreens Pharmacy Partnership Program, the consent process. I know DDS and ARCA are coordinating with California Department of Public Health, and also our advocates, the aging community, and SCDD, Executive Director, Disability Rights. They're advocating that our consumers be included in that 1B, phase 1B prioritization, because I think right now they are at 1C. And then, oh, with regards to this as well, before I forget, if you received the health advisory last Friday, you will see there in my section the letter from the advocates that are members of the California Community Vaccine Advisory Committee advocating for our consumers to be in 1B. And there's also a link there for a survey that you may fill out to show them the support that we have, that we wanted our consumers to be included in 1B. And then the Department of Social Service has given the names of the care homes to the CVS Walgreens Pharmacy Partnership Program, so they could have that. Initially, this CVS Walgreens Pharmacy Partnership Program was only by individual registration, and there was a deadline. So there was a lot of people who weren't able to meet that around November, October of last year. But because they have given the name, so they are now included in that. So that's really good. The advantage of this is CVS or Walgreens will go to the care home to vaccinate the staff and the consumers, especially those consumers that are non-ambulatory. So that's really good for them. I wanted to show you this. We were talking about the vaccine mRNA. This is a nice, kind of like a very general overview of what the vaccine does. So this mRNA thing, this one that looks like a spiral thing here, this is what the vaccine has. So when it goes to your system, it has the information to make the spike protein. So what is the spike protein? If you see here, this is the coronavirus. This things that kind of like gives it that crown-like appearance, and that's also why it's called coronavirus, because it looks like a crown, corona. These are the spike proteins. And so that is what this mRNA has. It will go to our cell, and then it will stimulate our cell to do that spike protein. And then it will be released out in our system. When it's released out in our system, our immune system, our antibodies, well, not our antibody, our cells that make antibodies will recognize that this is a foreign object, and they will then make these Y particles, these are the antibodies, so that we have it in our system. And then in the future, when you get infected by the coronavirus, you are already protected because you have the antibodies in your already. So that's kind of like a very general way of describing how the vaccine works and how it protects you. This kind of like tells you a little bit about, in the news, you've heard about this mutated strain from Europe that's going around, and a lot of people are thinking, will the vaccine still protect us from this mutated strain? So there have been studies, like there's another strain before that showed, and in that study, it showed that they are still protected because it's reacting to the antibody of the previous strain. So Pfizer and Moderna are comfortable that their vaccines will be effective against this mutated strain. They are doing their studies on that as well. And they said that should there be a need to reprogram for a new type of vaccine, it will be easier for them to do that. So let's get vaccinated, right? I got my vaccine today. It's good, I'm doing well. This morning, I just had a little bit of sore arm, like about an hour or so ago, but now it's really gone. So when you get vaccinated, you will be given this card. It will tell you what type of vaccine you were given. If it's Moderna, you would be coming back after 4 weeks. If it is Pfizer, you will be coming back after 3 weeks. This one is just like an overview of how, so you guys have an idea, how is the vaccine, how does it go from the, I guess, from Pfizer and Moderna to us? What is the process? So first, they have to enroll providers. They have to know who are going to give the vaccine. So there's a huge process on that, lots of paperwork. I've seen it. That's why I know it, to apply to be a provider, vaccine provider. Once you finish that paperwork, public health will review that. And if you get approved, they will allocate vaccine for you. They will order it for you. And then Moderna and Pfizer will then process that, ship all of that through you, depending on what type of temperature they have to be stored in. And then once it is received, it's usually received through the local county public health offices. And then the local county public health offices, or some will call it LHJs, the local health jurisdictions. They're also the local county public health office. They will distribute it to the provider, and they will have to definitely have a proper storage and administer the vaccine. I wanted to point out here this website, the Community Vaccine Advisory Committee. This is part of their slides. They have meetings that are open to the public, and these are their next meetings. If you wanted to attend, go to their website. And you can also make a public comment by emailing this email here. So other update, there are other companies that are making COVID vaccine. Novavax is right now in the phase 3 trial, enrolling adult volunteers, and AstraZeneca and University of Oxford. Right now, they are approved in the United Kingdom to use for emergency use authorization. They haven't been approved in the United States. There's news that it might be delayed because of some safety issues that they are trying to investigate with regards to the dosing of this vaccine. So this is just a nice overview that I wanted to show you. When a vaccine is approved by FDA through that emergency use authorization, the CDC ACIP, or Advisory Committee on Immunization Practices, meets almost immediately the next day after it gets approved. And they're kind of like the outside review group that looks at the safety of this vaccine, and they also help give guidance as to how it's going to be distributed. Each state has their own policy on how it's going to be distributed. For California, we have our Community Vaccine Advisory Committee that works with our local county public health offices. And then whatever they decide, they then give it to our local county public health offices for implementation. So this is just a general overview of the phases of how the vaccine will be distributed. This has changed now. Whatever is in phase 1, 2, and 3. I don't think there is a phase 4 right now, but this was back in November. Eventually, the phase 1, they have subdivided into 1A, 1B, and 1C. And this is part of that guidance that I told you that ACIP is releasing different guidance on how the vaccine distribution will happen. And in our state, CDPH has given further guidance on how that vaccine distribution would be. And so phase 1A has been subdivided into tier 1, tier 2, and tier 3. So I wanted to emphasize this is still phase 1A that was subdivided into tier 1, tier 2, and tier 3. This is just another visual for you because sometimes it's so confusing on how that subdivision happened, phase 1A, 1B, 1C. If you click this link here, it will go to that document that I showed you there. So that's what this one is, so for phase 1A, and we are still in that right now. This is just another way to view that phase 1A, tier 1, skilled nursing facilities, first responders, paramedics, healthcare first responders, dialysis centers. Phase 1 A tier 2 are for the intermediate care facilities, home care, home health care, and in-home supportive services, community health workers. I highlighted that because that is where Stanislaus County has included VMRC and our vendors. And then the tier 3. HHS has planned for a possible phase 3 of ongoing vaccination program in the future, should there be a need for that. For VMRC, we're going to be having our COVID-19 testing at Modesto office, actually. Registration is required. You go through our website, click the coronavirus tab, and there is the last week's health advisory. There is a tab there for registration. So it's open for VMRC consumers and families, for VMRC staff and families, and for provider, vendor, staff, and their families. The reason for that is each one of those really would eventually affect our consumers, your family members, my family members. When we work with our consumers, that affects that. That translates to that. So we want to make that as a public service for our community. If you cannot go there, Pixel by LabCorp is an FDA-approved home health testing kit. It's for 18 years old and older. It's a nasal collection, meaning it's just there up to the tip of your nose. It's not going to go all the way inside like you feel like it's going to your brain. It's not going to be like that. You order this online in this website. They send it to you. You register the kit. I've tried it. I've ordered it online. It doesn't need any doctor's order. And then you send it back to them through FedEx Priority overnight. You get the result like a day after they receive it. So this is a good one if you need something for your home. LMA COVID-19 home test is another FDA approved. This one is approved for 2 years old and older. In their approval, it said that it will be available in pharmacies. I haven't seen it though. The good thing about this is it takes you only 20 minutes and it gives you the result. So I just wanted to emphasize still, after you get the vaccine, still continue to wear your mask, physical distancing, washing your hands, and avoiding crowds, especially now. Our cases are so high. And definitely eat healthy foods. You could have vitamin supplements, water, exercise. Oops, I'm not gonna play this. Take care of your mental health and wellness, well-being, relaxation, deep breathing are things that are gonna be helpful to you. This is a good mindfulness app that you could use. So that's basically it, really. Thank you all. I have a reference list here if you guys need to when this is posted, if you want to read further. So I will be opening the floor to questions. We have about 54 here, participants. Do you guys have any questions, things that are bugging you?
So I do have a quick question.
I'm still not really clear how the vendors in the comprehensive programs go about getting the vaccination.
So for Stanislaus County, Olivia has contacted our ABA providers and have given the Excel spreadsheet. Once you get that, when it's filled out, she gives it to me and I forward it to our Stanislaus County person. For comp programs, our program manager have been collecting that for Stanislaus County as well. And they've given me that and I forwarded it as well. So far, before we started this webinar or meeting, the last information I got from Stanislaus County is that the ABA programs that I submitted to them could go there on Tuesday. And let me actually check who those programs are here. Inspired Behavioral Solutions, BEST, Butterfly Effect, Synergy, Candle, and Life. So those are the ones that they have input the names and could go there Tuesday, tomorrow. The others that are not yet there, I've given it to them, but they are still in the process of inputting the names, and I'm awaiting them to tell me when they can go.
So in San Joaquin County, is anything happening in San Joaquin County for the comprehensive programs? The non-ABA ones is where my interest is. Other people might want to know the other.
For San Joaquin County, it's kind of like different. This morning, the notice that San Joaquin County gave was for care homes, family caregivers, and ILS, IHSS providers. There was a lot of confusion that happened there because of the word family caregivers. So that is definitely something that we've been trying to clarify. I know Tony has contacted Dr. Park about that, and the goal really for vaccination is to assist our consumers that are living in their families, because basically if you vaccinate their provider, you're basically almost protecting two people, because if the other one is protected, then you are and will not get sick. Most likely you'll protect the other one as well. That's kind of like the notion there. We are going to be clarifying more with regards to comprehensive programs. I know there are a few who have tried contacting the link that was given, the appointment phone number, and were able to schedule. So that's excellent if you were able to schedule. Some are saying that's basically how I'm thinking, is if you tell them that I am a provider, that I help families and support them in their home, I think that would help. I see Tony here. Tony, do you have anything to add to that?
No, I think you pretty much got it. So some people were able to get in if they called in, and the main focus was on supporting people in their homes. So the residential providers, the DSPs that do that, and the SLS, and so that was the main focus, and the family caregivers. But there was also an argument to be made that some made that the work that they were doing was face to face in a person's home, and it was helping them maintain themselves in their home. So, and then that was the purpose for it. I think if anybody didn't take us up on that today, they may be able to schedule, but tomorrow is a new group that's going to have the priority. So I don't know that we would necessarily get bumped or anything, but a different group is the target for tomorrow. But we could get in, could still get in. And if you call today and schedule for later in the week, that's another thing that was pretty common. I saw a lot of that. So yeah, that's all I would add to that.
So we just have staff call and say, I work with people in their home. I guess I usually need specifics. And I'm not clear whether comprehensive program should be calling now, or this is really for IHSS in the support people in the home that don't have an option. Is there any clarification on that? Can comprehensive staff just call and say, I work from home? Do they need support from BMRC to verify that?
It sounded like the supports that anybody did need. Some people did need verification that they were vendors of BMRC. So there were some that asked for that. They weren't really giving that much of a distinction. The purpose was to maintain people in their homes. So if it's a licensed home, that those DSPs, if it's their family home, then their family caregiver. And then anyone else who was supporting someone to maintain them in their home, there wasn't any distinction that said they could not. So Debbie, that's as close as we can get, and it's probably more than, that's actually what you want. If no one said no, so I would have said, if you, what you're doing is supporting someone in their home, then that was the purpose for today's priority.
Claire, with Stanislaus County, is there, again, I hope this isn't just a one-day window, or does it just open up tomorrow? And then what are the hours when staff would show up? Because I know they're not giving appointments.
Okay, before I answer your question, Colleen, Debbie, I will reach out to San Joaquin again. I wasn't able to do it before this meeting to send them an email about that, but I was planning on, so I just wanted to let you know, I'm planning on sending them a communication, clarifying that with regards to comp programs, ABA providers, other vendors that are supporting our communities in the home. So we could have more clarification on that. And then to answer Colleen's question for Stanislaus County, they actually have a big list. Let me see if I can share it to you guys. They have a list of those that they have for that day. And if that company is in that list already, they said when I was in line there today, they said you can come at a different day and still get vaccinated because you're already there. So they have this, they're posting it there. It's a huge paper printout. They post it there and they update it. So for today, the ones that are related to VMRC here are here, VMRC staff, Above the Clouds, Baby Moves, Communication Station, and steps. They are accepting IHSS workers, so it's in here. I saw that list of IHSS workers and behavioral health in their Friday list, because when I was there, they still have their Friday list. And then they put up their new list for today, Monday. So whatever was in there before, they just added the new ones, and the previous list, they still have the previous group of people. So they said you can come at different time. It doesn't have to be today only for these group of people.
So the list you read off earlier, which we were on, is for tomorrow, though, starting.
Yeah, the ABA providers that I mentioned, I was told that's going to be for tomorrow, Tuesday.
So do they have to be on the list that we already submitted, or is it just anyone within that agency?
It has to be in that Excel spreadsheet list that you guys submitted. Yes. Thank you for clarifying that, John.
Mm-hmm.
And what time can they start showing up, and what's the address?
So they start at 9 a.m. You could get there at 8:30. I was there at 8:20. There's already a line. There's probably like 6-7 people ahead of me already in the line. I don't know the exact address, but it is the Health Services Agency at Scenic Road in Modesto. If you Google that, it'll come up. It's a huge building with a huge parking lot, Health Services Agency in Modesto. If I'm at 8:30, I think 830 is the address, but don't count me on that.
Thank you.
You're welcome.
And then I had a quick question in regards to, you said family members of staff. How would we go about that with our family members?
That is for the testing. So that family members of staff would be for the testing. VMRC is going to have a COVID-19 testing. It's not vaccination, it's just for the testing on Friday. You go to the link in our health advisory, register each individual. Thank you, Linda, for putting the address. Each individual, to have no glitch, would be good to have their own email address when you're registering to that link for our COVID-19 testing. So that one, we're going to be doing the oropharyngeal. So it's like when you're going to the doctor, they're testing and looking at your tonsils. It's going to be like that.
Perfect. Thank you so very much.
You're welcome. So for
I
that
put a
one,
link
oh yeah.
I put a link on that so you don't have to go into the health advisory for that now. You could go to that page, the COVID-19 page that we have, and it's on the top of that. I just did it.
Thank you, Tony. And then for that, I just want to let people know the email address, we're going to be using that to give you your result. If it is a negative result, we email it to you. If it is a positive result, you get a call, then an email. So that's why you need to have your phone number and your email address there.
Claire, this is Florencia up in Tuolumne County, and I was wondering if you have any information, any updated information on when it would be available to direct staff ABA providers in Tuolumne County and what that process would look like?
I don't have information for Tuolumne as of now. That's also another one that I would have to follow up with regards to the ABA and comp programs. Comp programs, ABA for the mountain counties as well. That's in our follow-up list.
Thank you.
You're welcome.
Claire, is there going to be a process for people in the future who need to be added to the list?
Oh, for other names of your staff that needed to be in there, you could either send it to me, John, and I'll send it to them.
Okay, just on an
Yeah.
ongoing basis.
Mm-hmm. I've done it with our own staff. There were some staff who changed their mind after a few days after I've sent, and they were okay with it. And then they tell me when they have uploaded that individual. They really wanted to have a list because a while ago somebody contacted them directly, and then they emailed me and asked me if that was really our vendor, and they're asking again for the list. So they really wanted that for Stanislaus County. Each county is different. If you are noticing, they have their own ways, they have their own processes, their own policies, and actually they have different interpretations as well of the groups. And not just in our catchment area, this is all over California. It is not something that is uncommon. That is how this is going out so far. Any other questions?
So Claire, any idea when comp programs in San Joaquin County might be added to that list? Is there any idea when that might happen?
I don't know yet. We're going to be following up on that. And if you have called this morning and they have given you an appointment, then yeah, excellent. I think they're still open until 6 or 7, so they might be accepting calls until that time. So if you try to call and get in, tell them you're a provider, VMRC vendor that is offering home support to consumers, and they let you in, then that's really great. I wanted to let you guys know I couldn't really tell you the time ahead of time because they usually contact us the day of. That's what happened last Friday. With all of a sudden they called and they're like, okay, we're gonna give you guys this link soon and you can send VMRC stuff. And we're like, oh, okay. And then the same thing here. They contacted Tony in the evening, like, okay, we're gonna give you guys an information tomorrow morning. Okay. So for San Joaquin County, it has been like that so far. So that's why I couldn't give you guys a date, an estimate of when it will happen. But we are definitely sending them follow-up emails advocating for our community.
Yeah, Claire, Mike here from LifeWorks. Back to San Joaquin County. In spite of not having a list, what is the number that staff could call to try to individually advocate for getting the vaccine?
It is the link that was sent. See, I don't know it at the top of my head. Let me try to.
I have an email that indicates the number in the filter. That doesn't work for me.
Tony said he'll try to put it in the chat.
Yeah.
That'd be
I
great.
just pulled up the flyer. It's 209-468-8255. 6820.
Thank you, Debbie.
Thanks, Deb.
I'm gonna try and see if there's anything in the chat that I am missing. Okay, the first one is answered already. Those who can go tomorrow, is there a window of time? Those who can go tomorrow, I'm assuming this will be in Stanislaus. I don't know up to until what time the Stanislaus County is open. I do know that you can fall in line as early as 8 a.m. They start at 9 a.m. I actually at 8:30 they start giving you the kind of like the consent form. And then they start letting you in at 9 a.m. I'm not sure though how long they are there. I'm assuming they're there until either 4 or 5 p.m. So just plan to be there, maybe the latest 3 p.m. to be sure. Jane Howard, you're welcome, Jane. It's our pleasure to help you guys. And Melissa, thank you. Melissa's also gonna be following up with Stan County. Linda posted the address of Health Services Agency there, 830 Scenic Drive. Thank you, Linda. And then Tony posted other information with regards to the San Joaquin County. Sorry about that. Any other questions, you guys?
Claire, Mike here again. I just wanted to say, thanks to you, Tony, obviously, and all the other folks there at VMRC for trying to navigate through all this stuff. And it's much appreciated. Okay.
You're welcome. And I actually saw Todd here. So I was reminded that our psych vendors, I've had Justin contact them as well. And when we get that, we'll give it to Stanislaus County. Yeah, so do you guys have any other questions? So far, the vaccine so far, we've had a lot of VMRC staff that have come there. So if you have staff that are kind of like hesitant, tell them so far we are all doing good. The most I've heard really is just a sore arm. My sore arm now is gone. It was just sore for like maybe 2 hours or so, and now it's gone. So yeah, if you would weigh the risk and benefit of, oh, thank you, Melissa. If you would weigh the risk and benefit of getting a vaccine versus the possible side effects, definitely have a lot of benefits of getting the vaccine to protect you. COVID is a really, really bad disease. Those that have had severe COVID-19 and get ventilated, it's not like getting a stroke or getting a heart attack and then you die and you don't really know it. The people who are dying from COVID, they are suffering from it. They are gasping for air. They feel it. They are really, really experiencing the pain and the difficulty of that. And then they're far from their loved ones because they cannot be there with them because they're isolated. So it's really devastating. So I cannot advocate more for those people who may receive, who can receive the vaccine, who it is safe for them and it's not contraindicated for them. And when, as CDC have shown, it's really mostly, it's pretty safe. The contraindications are just those that have had severe allergic reactions. So I really am highly recommending you guys to get the vaccine if you can. I don't want to end it yet just because maybe Melissa will give us an update since she's on the phone. So if you guys have any other questions, just let me know. I know I just remembered this because Colleen emailed me about this, about the vaccine being mandatory. So the federal government and the state haven't decided to make it mandatory as of now. It's voluntary. You guys decide if you need the vaccine or not. They may or may not be agencies or companies that will mandate that, but I'm not sure. That is definitely going to be their decision if they do that. And but as of now, especially for VMRC, it's something that is voluntary. And I'm sorry for the background noise. That's my daughter. If you're hearing her, she is reading something. She's playing. Oh, sorry. Yeah. Any other questions, you guys? I guess you're welcome, guys. I think Melissa will definitely update us. I don't see any other questions from you. So thank you guys so much for all that you're doing in our community, for our consumers. Thank you so much. And for being patient, for being very patient in this process of vaccination, for being patient all throughout the year with all the remote services that you guys are providing, and those that are still providing face-to-face. Thank you guys so much for doing that. I know you guys are putting yourselves at risk for doing that. So we really, really appreciate you, all the things that you do for our community, for our consumers. Really, really appreciate. Okay, this recording will be posted hopefully within the week or maybe next week. We'll be posting it in our website. It's going to be under the events, under clinical tab. It'll be there. So for those that wanted to view at a later time, and also the PowerPoint, it will be there. Okay, thank you guys so much. You guys
Okay,
have
thank
a
you,
good
Claire.
weekend. Oh no, a good day. It's just the start of the week.
Okay.
See ya.